A day on the job for a police officer isn't what it used to be. As we all know now, a lot of their time is spent dealing with calls related to mental health. While that takes a toll on the person officers receive the call about, it also takes a toll on the officers who respond. 6 on Your Side's McKenna King tells us what treatment options are available to Boise police officers who are dealing with traumatic situations every day in today's Finding Hope.
The Boise Police Department says nearly 70% of calls they get are related to mental health. Through peer support and free counseling, the Boise Police Department provides a list of ways to help their officers stay healthy mentally.
We have a peer support team and we have designated officers that we put through training.
The first line of assistance available to all officers in the Boise Police Department at all times.
We are simply peers who have been around a while and seen some of the things that maybe the newer officers are going through.
Because when you're in a high-stress career field, helping your community cope in the midst of mental health crises on a nearly day-to-day basis, a support system available for the people who are always assisting others is crucial, especially following an instance where an officer has to use their last resort.
Nobody in this profession takes lightly the issue of deadly force. And it's a great responsibility that we bear.
But it takes a toll on an officer and on their families at home.
You might see officers seeming to be lighthearted in their day-to-day interactions with each other. But when it comes right down to it, if you're involved in one of those situations, it is a big deal and it does have an impact on you.
And while Weiniger says peer support is one of the best ways for officers to cope, sometimes it isn't enough.
If something's really maybe going awry and it's been a long time and you're having issues with that, we definitely encourage officers to reach out and get professional help.
Through Boise Police Officers Insurance, they're able to seek that professional help whenever they need it.
No different than an officer twisting an ankle. You would not have a stigma preventing you from going to the doctor and getting that treated. So there shouldn't be a stigma in some of the emotional injuries that we encounter in the career.
And Weiniger says there are many counselors in the area tuned into the specific culture of first responders.
And during this 2019 legislative session, the state legislature passed a bill requiring workers' compensation to cover treatment for psychological trauma sustained by first responders while on the job. In studio, McKenna King, 6 on Your Side.